Hello, my name is Dr. Robin Abramczyk and I'm a dentist in Heath, Texas. Mayor Rawlings and Dallas City Council, I would like to thank you for this opportunity to explain why I oppose water fluoridation. I do not offer fluoride in my private practice, nor do we have fluoride in our household. And we could talk on for days about fluoride in the studies, however I would like to limit my scope to the issues I find most relevant in helping you make your decision. I would like to start by asking, why do we have fluoride in our water supply? What's the purpose? Most people would answer that question and believe that fluoride prevents or treats cavities, but based on research of well-done studies, simply is not true. In 1999 and 2001, the CDC stated that the main benefits of fluoride are mainly topical. So why would we ingest fluoride? If we have dry skin, would we drink our lotion? Absolutely not, and it doesn't make sense. The FDA has never approved ingestion of fluoride to treat dental caries. According to the FDA, fluoride is a drug, yet we give it to the masses. This is a violation of informed consent. The National Institute of Dental Research conducted a study of 39,000 children in multiple communities, and what they found was less than a 1% difference in dental caries in fluoridated and non-fluoridated communities. The NIH also performed a similar study and found the same results, meaning a non-significant difference in dental caries between fluoridated and non-fluoridated communities. Also, tooth decay does not increase when fluoridation is stopped. As you well know, the ADA is a strong proponent of fluoride. However, if they were wrong on an issue, wouldn't you want to know? I was taught at Baylor College of Dentistry that fluoride is great and that we should give it to our patients with the exception of babies. When I started my private practice, I began to have patients who refused fluoride and would explain a little bit about why they refused it. I wanted to know the truth, so I began to do my own research, and what I found shocked me. I knew based on my science background that fluoride is the most electronegative element. It's very unstable, it's highly reactive, and I knew it competes with iodine, and iodine is located in our thyroid gland. It's also very reactive with magnesium and phosphorus. In fact, in the 20s, patients who had thyroid issues were given a fluoride bath, and it wiped out their thyroid gland. And there are also studies that have shown a correlation between fluoride and bone cancer and fractures. I studied more, and I learned about the Clean Air Act and how fluoride is toxic waste. And I learned about fluoride in the air can actually wipe out and desolate crops. In fact, the USDA states airborne fluorides have caused more worldwide damage to domestic animals than any other air pollutants. 33 studies in China, Iran, India, and Mexico showed a correlation between lowered IQ and fluoride. And before you dismiss a study performed in a foreign country, I would like to ask, what kind of car are you driving? Excellent science and technology comes out of foreign countries, and we shouldn't be so quickly to dismiss those studies. There is not a single biochemical process in the body that requires fluoride, yet it interacts with many of the enzymes in the body and causes deleterious health effects. Fluoride is related to a host of health issues, including lowered IQ, infertility. It accumulates in the body. Related to arthritic symptoms, it negatively affects the thyroid gland and kidneys. It's related to hip fractures and cancer. In fact, 4 studies in JAMA have found that there's an increase in elderly in hip fractures whenever they're taking fluoride to treat osteoporosis. And what I find particularly upsetting is that there's certain subsets in our population that are more sensitive to fluoride than others, namely people who have kidney dysfunction, children, elderly, and infants who are bottle-fed formula. Some of these families cannot afford bottled water, and even the ADA recommends making this formula with fluoride-free or low fluoride water. However, these families, many of them have no choice. And I'm a mother of 2. I was never educated on this fact. So, we have established that water fluoridation does not prevent cavities. It is related to a host of other health problems. It is particularly discriminatory towards some lower income families, and it doesn't accomplish what the proponents claim. So it's harmful, not helpful, and it doesn't accomplish what we are told it does. Then why would we ever do it? If our goal is to reduce dental caries, then let's focus on the problem. Let's focus on educating families on oral hygiene, on improving access to dental care, and on nutrition. Mayor Rawlings and Dallas City Council, I would like to thank you.